Welcome to the CT Educator Podcast. I am your host, Karina Hogan. I am a registered CT technologist with 20 years of experience and knowledge. I help new CT technologists level up their CT training so that you can become a successful technologist. I'm also a mom and committed to sharing my knowledge and expertise to help you build your confidence, know the CT basics so that you can deliver quality patient care. So let's get into it. Hello. Welcome back, wonderful technologists. Welcome back to the podcast. So we are getting to the end of 2024. I can't believe it. Like this year and these couple of months have gone by so quick. Honestly, to be really 1,000% honest, I'm kind of wanting 2024 to be over. There have just been a lot of things like in life for me that have just lifed, and I'm ready to have a fresh start with a brand new year, brand new goals, and a brand new plan. So, little housekeeping as we come to the end of 2024. So there are going to be about 4 more episodes. So in the next 2 to 3 weeks, you are going to see a few more episodes each week. So I am going to drop 2 episodes next week and then 2 the following week. So make sure you guys stay tuned for that. Okay. And those will be the last 4 to 5 episodes for the year. And then I am going to pick up recording once again in the second week of January, where on the podcast, you are going to get 2 episodes each week. So I will be dropping podcast episodes for the CT Educator podcast every Tuesday and Thursday. So make sure you guys follow me on Instagram. Stay tuned for that. And make sure you like, share, subscribe to the podcast so you can get the latest and greatest. Okay. Also, the very last episode for this year is going to be 2024 year in review. So what I'm going to do is I'm going to pull the best and the most listened to podcast episodes. I'm going to give you some short clips in one entire episode. And so you can just take a listen to all the most popular episodes that people have streamed, people have liked, people have commented on, so that you can get a good feel of what's to come for next year. Because I've got a lot of exciting topics and I've got a lot of exciting things that I am planning for 2025. The CT Educator podcast is going to YouTube in 2025. I will drop the dates as far as when in January that will be live and available to you. So make sure you follow me on Instagram because I will be dropping that date. Make sure you check out the rest of the podcast episodes for this year and for this month to know when that date is. I'm super excited about that. So you will get video content, long form of these podcast episodes. Also, if you are interested in getting coaching and making sure that you hone in on your skills to be the go-to CT tech, make sure you come and join my coaching program. I will come and coach you and mentor you for 6 months. The price is $5,000. There are payment plans available to make it more affordable for you, where I give you 6 months of a course portal. You get 1 live training every single month. So that is 1 live training every single month. You get downloads, PDFs. We do all the things. I also help you workshop for the registry, where we do a registry review workshop. And I give you all my knowledge and tools and tips on things that you can study for so you can pass the registry. I have taught the same things to many technologists that I have trained over the 22 years I've been a technologist, and they've all passed the registry on the very first time. So you want to learn from the latest and greatest and from the best, come join my coaching program. Okay. So I have 2 different programs that I offer. So right now I am taking 10 spots for my 6-month program. So make sure you check out the show notes, check out the links, and come and get coached by me. Okay. All right. So in today's episode, what we're going to talk about is advanced imaging. So what do I mean by advanced imaging? So we're talking about our CT cardiacs and our CT procedures, i.e. biopsies. Okay. Now, as CT technologists, we are used to the routine flow of your abdomen and pelvises, your heads without, your PE studies, your CTA head and necks, and all the, workhorse, just meat and potato scans that we do, right? So as you start to gain experience and you start to get comfortable and you start to know those complex exams, you start to branch out into more advanced imaging. So that is your cardiac CT scanning and your CT procedures and biopsies. Okay. So we're going to take both of these topics and we're going to talk about both of them. So CT procedures. This is where we work alongside IR. So we have the IR radiologists, the, IR nurses that come into CT. We use CT as a guide for the IR radiologists when patients come in for different types of diagnosis. Let's say they need a chest tube placed, they need an abscess drain, they need a biopsy of some kind of mass tumor that they found on a PET scan or a prior CT that needs a biopsy to figure out what it is. We do a lot of something called cryoablations and microwave ablations. That's where they freeze tumors or they microwave, so they burn tumors with different patients with different types of cancer diagnoses. So there are CT systems out there that use CT fluoro so that the radiologist can go ahead and control how many images they want, where their needle is, how far, above or below they need to be, and they have complete control of the scanner. Okay. And then most CT systems, what they have is that we go in, we do a biopsy mode or take, 10 cuts above, 10 below, whatever the case is. And we go ahead and make sure that we are exactly where we are when they place that needle. Okay. I do a lot of CT procedures and I've done so many procedures over the years. It's crazy. Okay. And it's one of those advanced imaging that I really have a lot of fun doing, okay? Because you get to learn a lot about what is going on with the patient, how these things came about, the prognosis of the patient, and how they take steps to make sure that they give the proper clinical treatment for the patients, right? And of course, the nurses will give some twilight sedation so the patient's comfortable during the exam. And we assist the radiologist in, giving them materials or, all the images or saying, hey, they need a guide wire or something to that avail. Okay. Now, the second thing as far as advanced imaging is cardiac CT. Cardiac CT, I know I've done cardiac CT for the last 15 years, and it just keeps getting better and better with the technology. So these exams were identifying the structures of the heart. So we're looking at all the vessels of the heart. And usually the patients get sent for a cardiac CTA for coronary artery disease. They have an abnormal stress test. They're trying to find out the source of their unexplained chest pain if they've had other imaging. Those are the types of reasons why they would order something as far as a cardiac CT. Now, I have seen two types of physicians that will work with us in CT as far as administering medications and monitoring the patients while we're doing these cardiac CTs. Because we also gate these exams where we use an EKG that is plugged into the scanner because it's going to gate the R wave to the R wave. Now, if you want more information on that, I do have a cardiac CT 101 course that you can check out in the show notes. Okay. So this type of imaging, we work with the cardiologist hand in hand. We have a nurse in CT that will administer these cardiac drugs because they administer nitroglycerin and they administer a low pressor to keep that heart rate at least below 60 beats per minute. 65 is okay, but we like to have like at least 60, maybe 55, 60. That's usually pretty good, right? Now, Cardiologists are involved with this because they're the ones actually reading these CTs. Now, I have worked at a hospital where a trained radiologist was the one who read these cardiac CTs. And from what I understand, if radiologists are going to be involved on this type of advanced imaging, they have to get additional education, credentialing, and training to be able to read these types of exams. Because there are some of them that do their own post-processing. And a hospital I worked at, that's what the radiologist did. He did his own post-processing. Okay. So those are the most important things because we want an optimal contrast enhancement on these vessels. So this 9 times out of 10 eliminates the patient from going to the cath lab and having an unnecessary cath procedure and having more radiation, right? Even though cardiac CT does, raise the radiation dose for the patient, but just imagine having a heart cath where you're getting poked in the groin and there's risks of infection and risks of other things versus having a cardiac CT, them rolling out what they need instead of going to the cath lab and then treating the patient clinically on what they need, right? So a lot of times we do the cardiac CTs to eliminate having a cath procedure when it's really not necessary. Okay. So those are kind of a couple of advanced imaging modalities that we do and imaging exams that we do in CT. I know that there are other ones like CT colonography and, CT bronchoscopy. Honestly, at the facilities I've worked at, they haven't introduced any of those, or they have phased out some of that because those programs weren't really working for them. And they have just kind of, if they have a patient, they'll do one here or there. But I know the bronchoscopy at one hospital that I did work at, it was kind of emerging, but I'm not sure if they've done anything else with that program since I left and took another position because I needed different hours. So, but at your facility, make sure you know what your advanced imaging is, as far as what you do, whether it's CT cardiacs, we all do biopsies all around the country and cardiac CT, there's CT colonography and all different types of advanced imaging modalities that you can learn from. So that is my episode for this week. So I hope I gave you enough information and enough knowledge because we do not gatekeep around here. And on just a couple of things that are very common when it comes to advanced imaging. Also, if you want to come and learn more about this, come join my coaching program. Okay. I am taking 10 students. We start in January. So make sure you guys get in on all the action and come get coached and come learn from me. Always, thank you so much for joining me on this podcast and listening to the episodes on this podcast. It really means a lot to me. So make sure you guys subscribe to the podcast so you can get the latest and greatest on every episode. So thank you so much for listening. I will chat with you guys next week. Thank you for listening to this episode. If you would like to share your CT experience, have an interesting story to share, or need help in your CT training, please email me your questions at contact@thecteducator.com. Follow along on Instagram at the CT Educator, also on Facebook at the CT Educator. Don't forget to like, share, leave a 5-star review as this will help support the show and it'll reach all of you that need guidance. Thank you for listening and happy scanning.